Come on. Okay, I see we're streaming live. Let me make sure I get it on my phone so I can see the chat before we get started. Hmm. All right. I see Facebook. Now let me get YouTube. I see that. All right, TJ, it's 1 o'clock. You can hit record. Well, good afternoon, everyone. It is 1 o'clock, and thank you for joining us for another conversation with the council president. I'm so excited that I have a guest here today to talk about a very timely issue, and I tell you, I need the information myself. And so I want to just thank everybody for 2020. We've got past 2020. We are now in 2021, and we certainly want to work to make this a better year. And one of the things that we need to deal with that is sort of at the foundation and core of everything that we were dealing with 21 and all of the things that came out of it is to really be able to manage COVID-19, to manage this virus and how it is in our community. I know most of you, like myself, watch a lot of news, so you know there's new variant strains out there that seem very concerning, that are more contagious. And so that means that more people may get it. Our numbers are through the roof nationally as well as statewide in terms of people in hospitals, people who are dying. And so I am so happy to have a guest that is very experienced in this, and I'm going to ask him some tough questions. And I encourage you to do the same. If you're on YouTube or you're on Facebook or wherever you are, please go ahead. If you have questions, put them in there now because we don't want to miss those. We want to make sure we get to them in the 30 minutes that we have allotted. But I'd like to introduce my guest speaker today, and that's Dr. Felipe Lobelo. He's an epidemiologist for Kaiser Permanente. And you all know I love Kaiser Permanente. That's my provider, and they're also a very good partner with the city of Atlanta. So Dr. Lobelo joined Kaiser Permanente, Georgia in 2018 as a senior physician consultant for population health research. And in 2020 became physician program director for epidemiology, public health, and preparedness in the Department of Quality and Patient Safety, the Southeast Permanente Medical Group. He also has an appointment as associate professor in the Huber Department of Global Health at Emory's Rollins School of Public Health. So everyone, please help me welcome Dr. Lobelo. Hello, Dr. Lobelo.
Councilwoman, hi. It's a pleasure to join you.
We need your camera so we can see you.
Some reason
and
it's
he
saying
is here. I know we've just had him on. His camera's coming
there
on.
There you go.
Dr. Lobelo, how are you today?
I'm doing good. Thanks for inviting me.
Let me turn my volume up so I can hear you. So how are you today?
I'm doing excellent. Thank you for inviting me, Councilwoman, and thanks everyone for joining us. Are you able to hear me?
For some reason, I'm having a little technical issue. I'm trying to figure out what I've done before. I'm hearing you twice, but can you hear me fine?
I can hear you fine.
Okay. All right. So I hope I'm not echoing like I'm hearing. But anyway, could you just kind of give us a sense of what's going on with COVID in the state of Georgia? That would be helpful.
Absolutely. And hope everyone can hear us okay. Stop me if not. But you know, as you were mentioning, we are in the worst part probably of this third resurgence of the virus that we've had in Georgia and across the country, of course. You know, there's more than close to 650,000 confirmed cases so far in Georgia, and more than 22 million and a half cases in the US. And obviously, what concerns us the most is the sharp increase that we've had recently in terms of hospitalizations and deaths. We've had the single day with most deaths in the US yesterday, tragic every day, with more than 4,200 deaths on one single day recorded. And the problem is that the worst has not come yet, unfortunately. We see an increase in cases, and we know that those hospitalizations are going to lag for 2 to 3 weeks, and then the mortality is going to come after that. So that's why we are constantly trying to plead with everyone to observe the personal protection guidelines, using the mask every time you go out of the house, and staying out of congregations of people, because that's how the virus transmits.
Well, thank you. Okay, I'm trying to figure out, I don't know why I'm having technical difficulties, but I'm listening through one phone and talking to you the other. We're going to make this work one way or the other. But one thing I want to ask you, because I see people with masks on, could you just before we get into some other things, explain how people are supposed to wear the mask and the importance? Because I see masks under their mouth, I see masks under their nose. I mean, explain to the people why that's important.
Yeah, absolutely. And I have, I think, one mask here, so I can demonstrate it's critical that we use the masks right, so that they work. And the most important thing is that it needs to cover both your nose and your mouth, because the virus transmits through the droplets of saliva that we expel when we talk, when we sing, when we yell. So, any mask that has a double layer is a good mask. I use, obviously, these medical surgical masks, and make sure that it's not on your nose and that it's covering well. There is not a lot of air coming out. And that's how you want to use it, because you don't want a lot of, again, saliva and the air that you're breathing to come out of the mask. And at the same time, as snug as you can have it, then it protects you from breathing the air that someone else has. So that's the idea, that it needs to be covering your nose and mouth.
Thank you. And I see, like I said, people pretend to wear the mask, but they're just wearing them on their chin. So let's talk about what's going on in terms of, we hear these dire numbers of people die, the situation with hospital space. How is Kaiser dealing with that? And, I know you all are affiliated with certain hospitals. What's going on in terms of treating people who are getting the virus?
Absolutely. So like I mentioned, we've seen a sharp increase. We technically entered this third wave or resurgence of the virus in mid-October. And back then, we had only a handful of our members hospitalized. Right now, we have over 130 members hospitalized. That means that we've had almost an 800 increase in the number of patients hospitalized because of COVID. So that's a tremendous amount of pressure on not only our health system, but pretty much every hospital in Georgia and in the country. And there is a lack of beds. That's what worries us, because if we need to hospitalize someone, we may have a very hard time finding a bed for that patient. And the same thing happens with the beds in the ICU. We have a very limited supply of ICU beds, because they're taking mostly because of COVID patients, but other patients that also need ICU beds. So what's happening right now is that sometimes there's a wait for a hospital bed or an ICU bed. We, Kaiser Permanente Georgia has core hospital arrangements with Emory hospitals. But unfortunately, most of our patients now are at non-core hospitals with COVID, because, first of all, Emory has limited capacity of beds. And second of all, there's no transferring of patients from hospitals because of the lack of capacity and because of the risks that we're seeing. So, that creates, again, a lot of tension for healthcare systems, because we obviously want to provide the best care for our members and everyone in Georgia.
So now there's a vaccine, and there's a lot of talk about vaccine. It was first a lot of conversation about getting testing, which I assume is still important. But what is this vaccine going to do to help this virus?
Well, the vaccine really is, in the medium term, the way that we go back to normal and the way that we sort of turn the page, hopefully, from this pandemic. But that's not going to be immediate. As you've seen, there are about 8 million people that have been vaccinated in the US. At Kaiser Permanente, we vaccinate around 1,500 members every day, increasing our capacity to vaccinate more. We started with our healthcare employees first, and as of Monday, we started with our members and everyone over 65. So we hope that ramp up in the vaccination in Atlanta, in Georgia, across the country will help reduce the hospitalization, because the vaccines, what they've shown is that they are able to reduce the likelihood of severe disease by 95%. But that's only going to happen at a population level when a large proportion of our country gets vaccinated. We're talking about at least 60 or 70 or even 80% of the public needs to be vaccinated for us to see is stopping the transmission of the virus and really stop the pandemic. And that's why you will start hearing us not only about the masks, which you still need to wear, but about the importance of the vaccine, and hopefully answering any questions that people may have about how they work, about how safe they are, because that's what we need to do to move on.
Well, I think you made an important point. So, and correct me if I'm wrong. So, the vaccine is pretty much not different than the vaccine you get for flu. So, I'm hearing you say that it doesn't keep you from getting COVID per se, but if you do contract it, either it will keep you from actually having severe symptoms. Is that what you're saying?
Yes. The studies that we've had so far have shown with a lot of conclusive evidence that the persons that take the vaccine have 95% or have 95% protected from severe disease, from being hospitalized essentially. We think that the vaccines will also help reduce the likelihood of getting COVID and also transmitting the virus. But the vaccines have not gotten, the studies have not gotten all the data yet to prove that conclusively. So that's probably something that we'll hear in the next few months, if indeed is proven in the studies that that we're conducting right now all over the country and all over the world. But for now, what we can say, as you say, is that it will protect you from getting severe disease, getting severe symptoms, needing to be hospitalized, and obviously that's the main message that we want to send.
So do they know yet if you did get the vaccine, how long the vaccine will be? Because we annually get our flu vaccines. Do we know if it'll last a year or a few months or what?
We don't have conclusive evidence, of course, because we've only had vaccine for a couple of months, maybe 6 months for the first patients that received the vaccine in the clinical trials. We do have evidence from different studies, for example, looking at the immunity of patients that have been infected with the virus, and that immunity lasts up until about 8 months. So we're pretty sort of hopeful, and there seems to be pretty good data to sort of back the idea that the vaccine will probably protect you for several months, maybe even up to a year or more. We will probably need to get other vaccines in the future, similar to the way that we do the flu vaccine every year. I cannot tell you if we're going to have to do it every year, every 2, every 5 years, but some sort of boost will probably be necessary because the immunity goes down with time. But at least we know the immunity is not going to be short-lived. At least we know it's probably going to be several months or probably several years.
Yeah, and so we're talking to Dr. Labello. For those of you who are out there, if you have questions, please put them in the chat. Our 30 minutes goes quick. We're halfway through it now, and I still got a whole lot of questions, so I want to make sure that I get your questions as well. So I do want to ask, we have a few different vaccines that I've heard. There's Moderna, Pfizer, BioNTech, and AstraZeneca. Um, and so I believe all of these are either out there or in the works to be there. So are these different vaccines, and who determines who gets what?
Yeah, that's an excellent question. So we have two vaccines that have been approved by the FDA and that we're currently using for vaccinating individuals in the US. We have the Pfizer vaccine and we have the Moderna vaccine. And both of those vaccines have very similar characteristics in the way that they were manufactured using mRNA. So they work very similarly, and they also have very similar protection, 95 over 90%. We have other vaccines, as you mentioned, that are in the final stages of their clinical trials. For example, the BioNTech, Novavax, Johnson and Johnson. In the UK, they've approved the Oxford AstraZeneca vaccine. That one has a little bit of a different technology, uses an adenovirus to get the sort of genetic material of the spike protein to show that to our immune cells so that we can generate protection. And that's being used in the UK. We'll see if the FDA approves it here. And it's a good idea. It's very important to have different vaccines because, as you mentioned, we're going to need a lot of vaccine first to vaccinate millions of adults. But we also have, logistical issues. For example, with the Pfizer vaccine, it needs to be at a very low temperature, and that will be difficult, for example, to distribute in rural areas in Georgia. So, other vaccines, like Moderna and other vaccines that don't require that kind of logistical, refrigeration, will probably be used in areas that are more remote. Whereas patients that are in the cities that can go to a hospital or a vaccination center will probably get the Pfizer or the Moderna one. So we need different sort of tools to fight this virus.
So I have one question. Oops, let me turn this down. One question in the chat. I want to make sure I get to them because I have plenty. But they want to know, once you get the vaccine, do you still have to social distance and wear a mask? They say they're hearing conflicting information.
You do, and I will explain why. I received my second dose of vaccine, but I always carry my mask if I'm going to be outside of the house, in the hospital, or outside, because even though the vaccine may protect me from severe disease, and I still need to wait probably a week or two in order for my immune system to be fully protected from after the second dose. Like we were discussing earlier, we still don't know if I can contract the virus, get infected with the virus, and pass it on to patients, to my mother-in-law, to my kids. So I don't want to be a vector for the virus. Similar to what happens with flu. You don't want to transmit the virus. You don't want to get infected yourself and be sick. But it's equally important to stop the pandemic by using the mask and by maintaining your distance until we stop seeing the virus transmitting. And when that's going to happen, we don't know. It's probably going to take several months, maybe all the way till 2022, because we need 80% of the population to be vaccinated before we can start thinking about saying goodbye to this virus for good.
So the other thing is, once you've had COVID, do you still need to take the vaccine?
Yeah, that's an excellent question too. I would, if luckily I didn't get COVID, but if I had, I still get the vaccine because the vaccine protects you better. It gives you a stronger and probably longer immunity than the natural infection. And you, of course, want to be protected for longer. So the recommendation that we're giving now is that if you had COVID, you wait around 3 months before getting the vaccine, because we know that when you got the disease, you're going to be protected for a few months. So you want to maximize your protection, for So that's what we're saying. Wait 3 months, and we also obviously want everyone to not have any symptoms of COVID before getting the vaccine.
So we have Miss Nesbitt. Oh, wait, hold on. She asked if you take the Pfizer vaccine and you are due to take the second dose of Pfizer and Pfizer is not available, can you take Moderna? If not, what are your options?
Yeah, we don't advise to get different types of vaccines. That's the recommendation of the FDA and the manufacturers. You want to get the same type of vaccine that you got for the first shot. So if it's not available, we haven't really heard about situations in which it's not available. But if that ever happens, it's better probably to wait until you're able to get your second shot than to get a different type of vaccine. So hopefully we're not going to get there. There's plenty of vaccine available right now, and Pfizer and Moderna and others are ramping up the production. Right now we don't have an issue in terms of availability of vaccines, but the ability to put them in arms, because all of our nurses, all of our healthcare workers are taking care of patients. So that's why we really need to help this process by staying home, using your mask, avoiding gatherings, so that the pressure on the health system can subside. We have more healthcare workers that can join the vaccine effort. And obviously, we need the state and the federal government to provide the resources, money, so that we can hire more people in order to vaccinate probably a million people every day is what we need to do, so that we can have 6-8 months of vaccination, and then we can sort of like get enough people vaccinated during that time.
So I have I guess a little bit more technical question. I've certainly been trying to keep up on these vaccinations, and so you talked earlier about the technology that's being used, particularly the ones that are available now with the mRNA, the messenger RNA. And you alluded to it, and I'm assuming, are you saying that the one from the UK uses a more traditional method of vaccination versus this messenger RNA? Because I think that, a lot of the stuff I see on the internet or whatever, people are really leery of the mRNA process.
Sure, it's understandable because it's a new technology. I say new because it's the first time we have a vaccine in the market that uses that technology. But this technology has been in the works for years, probably 10 years. And luckily, we're able to take advantage of that, technology sort of development over 10 years, so that we could, have it ready for, these new mRNA vaccines. The Oxford and AstraZeneca vaccine uses a technology that has been used in the past for other types of vaccines, but is not commonly used. And as you were mentioning, it uses another virus, in this case, an adenovirus, which is a common cold virus, to get the information about the COVID protein to the immune cells, so that we can generate a protection. I actually think the mRNA technology is much more efficient, and is probably safer in terms of the side effects, the immediate side effects that you may feel. We've seen with the Oxford and AstraZeneca some side effects that are not long term, but you may feel sicker 1 or 2 days after you get the vaccine, whereas with the mRNA we haven't seen that that much. And it's a very elegant technology. I try to explain it, and I took this from Dr. Frieden, a former CDC director. This mRNA technology is like sending an email to your immune cell with the information about the virus. But then that email is like Snapchat, and it just goes away. It disappears. And that's what happens with the mRNA. The mRNA gets into the cell so that the cell can produce the spike protein, and then that the immune cells can generate the normal reaction. But then that mRNA doesn't enter the nucleus of the cell. That mRNA is just something that disappears. And that's sort of analogy. I like it very much because it's an easy way to explain this sort of complex, novel technology, but I think it's very elegant. That's what I decided to use. And so far I haven't had any side effects or issues, just only a little bit of soreness in the arm. And I really encourage everyone, if you're in line, if you're in the group that's getting vaccinated, to do it, because it's the way that you're going to protect yourself, your family, but also help us move on with this pandemic.
So if you had a crystal ball, kind of knowing where we are with the vaccine that is available, where do you see us in the next 6 months?
Yeah, I wish I had a crystal ball. And I think all the epidemiologists are being asked, how long is it going to take? And I'm sort of a glass half full person. It's wonderful that we have the vaccine, but it's also, it arrived in a moment where we are going through probably the darkest period in the pandemic, with all these hospitalizations and deaths. So we need to be humble in the sense of understanding that we are in a war against this virus, and right now the virus is winning. We have a wonderful new tool, which is the vaccine, but it's going to take some time. Probably the best part of 2021, before we see enough people vaccinated so that we can see a reduction in transmission of the virus and a steady reduction in hospitalizations. How long? I cannot tell you. It really depends on how fast state and local governments are able to deliver the vaccine into arms, not having the vaccine stockpile, but also how the population decides to go about this war against the virus. Are we going to hunker down, do what we need to do right now in terms of our personal protection, and also agreeing to get the vaccine, or is going to a lot of people going to be hesitant about getting the vaccine? We've seen sort of this bandwagon effect that as more people have been vaccinated, as millions of people, 9 million people in the US, with very little issues, more people sort of feel more confident getting the vaccine. So we hope that bandwagon effect is going to increase, that you get into the train that's going to get us out of the pandemic.
So one other question before we wrap up. So is this going to be around with us forever? Is it going to be like the flu, that, we never actually get rid of this virus, but we just have to continue to manage it over time? Is that what you're saying?
It's possible. Keep in mind, there are other coronaviruses that, produce, common cold type of symptoms, and we've had those before. It just so happens that this coronavirus, mutated to produce more severe disease, and is much more contagious. And now we have the worry of these sort of new variants, of these new genetic changes in the virus that we're seeing in the UK, in South Africa, here in the US, and in the state of Georgia, we have it. And the worry is that, as time goes by and as more people get infected, the virus has more chance to change. And, it may make the vaccine less effective. It may make our treatments less effective. It may make more severe disease. We don't know yet. So that's why we really need to, speed up this war against the virus and get rid of this current version of the virus, to not give it time to mutate. If the longer this virus is in humanity, the more chances it has to mutate and produce a different variant that is more deadly or is more contagious. So another reason to use personal protection and get the vaccine as soon as possible.
So I had one other question from the audience I want to ask. And they said, what about the highly contagious virus that is now here in Georgia? So are we seeing that here in the state?
Yes, we've seen at least one documented case, and there are several documented cases across the country. So it's safe to say that this variant is circulating in the community. Is it the most common variant? Probably not. We think it may be 1 or 2% of the cases are due to this new, genetic mutation of the virus. But the problem is that this variant is so contagious that it has the capacity to become the dominant variant in a very short period of time. We saw that in the UK and Ireland, where in 2 or 3 months, they were, just finding this variant. And then after 2 or 3 months, more than 50% of the cases are due to the new variant. Wow. And that's why they went into a lockdown, because it's an explosive growth this variant causes. So again, another reason to stay home, use the mask if you're outside of the house, because all of these personal protections are going to protect you against the new variant. You just need to be more careful. I try to explain to patients and folks, if we use sort of this 15-minute window as a potential risk factor when we're close to someone, Maybe now is 5 minutes because of this new variant. It's more contagious. If you have access to an N95 mask or a K95 mask when you go outside of the house, I'll probably wear that because that gives you better protection against these potential new variants. So, we have, we're battling this new variant, and we don't want that variant to become the most dominant so that, we see more explosive growth in a surge on top of a surge. That will be a real catastrophe for our healthcare systems. We are in a bad spot, and we don't want to be, dealing with this new variant.
Well, Dr. Felipe, thank you so much for your time. You've given some great information. Is there any parting words or anything that you really, really want to stress with our listeners today?
Yeah, make your appointment to get your vaccine. If you're over 65, you can call the DPH number. You can go your hospitals, the healthcare systems. You can call Kaiser. We are delivering the vaccine right now. It may take a few weeks for you to get it, so you want to be in line now. Minimize the chances of having to wait too long before you get the vaccine, because it's the best thing that you can do to protect yourself, others, and to protect the healthcare systems that are in a real strain right now.
Thank you so much for your time, and thank you all for listening. We will replay this and have it up, so please share it with your friends because we need to get a hold of this virus, and we want to thank Dr. Lobelo again for his time. You've had another conversation with Council President. This has been a crucial one, and we've gotten some great information. Everybody, please wear your mask properly. Make sure you do your social distancing and your hygiene. I say that all the time, and I think that we hear it a lot, but we need to do it a lot. Thank you all for your time, and have a good and safe afternoon. Bye-bye.
Bye. Thank you, Councilwoman.